Hi there, I'm Linda Weiner. I'm an ASEX certified sex therapist and CE provider, and I'd love to talk to you today about a technique that I'm known for called Sensate Focus Touch. Sensate Focus was invented by Masters and Johnson, the folks who developed modern sex therapy, and it's a series of structured touching opportunities that help individuals and couples learn to turn off the thinking brain and be in their body, and deal with distractions, negative thinking, and helps in many ways from helping individuals bond or reconnect with their body after a medical procedure, for example. Also helps people with sexual dysfunctions. So Sensate Focus is used in a variety of situations with a variety of different kinds of individuals and couples, as well as different sexual difficulties. Because touch is magic, it helps with bonding. And also there's a cognitive component that helps people learn to turn off the critical thinking brain and be back in their body. One of the reasons that it works, besides the touch is magic, is that it reduces all kinds of pressure for the individual to feel, to like it, to feel aroused, to be responsive, and also eliminates pressure from the partner having expectations, which sometimes leads to the problem of low desire. So how can Sensate Focus Touch help allied health professionals, including physicians, nurses, PTs, and others? So whether it is psychosocial or medical, or a combination of medical and psychosocial factors, Sensate Focus Touch can help your patients learn to relax, learn to be in their body, learn to connect, and learn to move beyond any barriers that may have become problematic in terms of body image concerns. So some of the kinds of patients that have been helped in using Sensate Focus Touch include people who have undergone cancer treatment and feel body image concerns get in the way of them being able to truly be present and be interested in sex again. Also, a number of patients with vaginismus find Sensate Focus Touch a helpful way to get relaxed and clear their mind and be present. Also, it's very useful for people who have experienced sexual trauma, helping them relearn touch in a safe way in which they're totally in control. So I'd like to tell you about Stacy, who was a patient who was helped a great deal with use of Sensate Focus Touch. Stacy had low desire following cancer treatment and some of the medications that she was on, and so was experiencing some problems with her husband, who was concerned that their sex life had been diminished and was concerned that it wasn't reviving. So using Sensate Focus Touch, Stacy was able to learn how to turn off her negative thinking and how to be in her body, and learned how to take it slow, and learned how to get a lot more stimulation, slowing herself and her partner down so that she could accumulate some sexual tension in her body. Stacy initially started with self-sensate focus, and she was asked to touch herself all over her body, minus breast and genital touching, and focus on what the feelings were, temperature-wise, where in her body she was warmer, where she was cooler, texture of hair and skin, and the third element was, did it feel different to Stacy when there was more or less pressure? In doing this exercise, she was learning to refocus on internal experience rather than, is this going to work? Is my husband going to be upset if this doesn't work? And a number of other thoughts that are very unhelpful, but of course quite natural. So after the initial self-sensate focus with no breast and genitals, Stacy was asked to include touching all over her body, including whatever part of her breast she was comfortable touching at that time. Given that she had a lack of sensation in her nipples, she was able to focus on other areas of the breast and the breast tissue and other areas of her body that had a lot of feeling, and she was able to move through that and begin to get a little bit of feelings of brief arousal. We then moved to genital touching that involved exploration, and she was able to experience some pleasure, and she was reassured that she could build up enough sexual interest to be able to feel aroused and to be able to have an orgasm, which later she was able to transition to her partner. Over the course of 3 months, Stacy was able to regain sensation in alternative places in her body. She was able to feel reconnected to her body and greater body acceptance. And she was able to discover other avenues for pleasure and arousal, which she was, over time, able to transfer to her husband and teach him about the no pressure, no expectation, no need for moving on sexually, just experiencing what was happening in the moment. So being in the moment, experiencing no pressure from her partner, and gaining a self-acceptance, Stacy was able to regain some interest in sex, and their marriage was made more sound and bonded by the experience of mutual touch. So to learn more, please go visit my website, www.sensatefocustouch.com.